So one, I'd like to convene this meeting today, or this evening. Start with the pledge of allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I'm going to ask Brandy Smith to do the invocation. No? Okay. Margaret, can you do the invocation for us? Okay. Anybody want to volunteer? Okay, I'll do the invocation. No, okay, Commissioner Williams.
Thank you, Mr. Chairman. If you're so inclined, please bow your heads in prayer. Lord, we ask for your guidance and wisdom as we go about the business of this committee. Please bring wisdom and amity, and even in the midst of disagreement, friendship to all of our deliberations. Amen.
Amen. Okay. Now we had quite a list last month, and I'm going to ask if you've had a chance to review the minutes from our March meeting. Could I have a motion to approve the minutes from the last meeting? I just have one little thing. We had Dr. Williams. Is it Dr. Williams or Mr. Williams?
Mr. Williams.
Okay, there's a little, on page 11, it says Dr. Williams here. Can I get a motion to approve those minutes? Okay, we got a motion by Brandy. Any second?
Second.
Okay, all in favor say aye.
Aye.
All opposed? Okay, so the minutes are approved.
Unless you mean jurist document.
And now if you've had a chance to review the agenda for today, I'd like to make a motion myself to approve the minutes for today's meeting. Do we have a second?
Second.
All in favor?
Aye.
Say aye. Okay, motions are approved. Okay. So I guess what's going to be the director's report, executive director's report.
Good evening. So this evening, we have an item for you all to consider that is additional applications and that have come in for your consideration. And so I want to back up because it's a little bit confusing. So at your last meeting, at your March the 11th meeting, you all reviewed and took action on 3 applicants for other person, registered nurse, and social worker. That was Monica King, Heather Rand, and Dr. Wendy Sellers. And immediately after that, or within the next week after that, and prior to the ability to put anything on the next Board of County Commissioners meeting, we received several additional applications, 5 in fact, additional applications. And so instead of taking to the Board of County Commissioners 3 applications and then bringing the other 5 to you, especially since some of those were for one of the positions that is open, which is the other person position. There are several applicants that only qualify for one specific position. So to enable you all and the Board of County Commissioners to be able to review all potential applicants for any of the eligible positions, wanted to just, all of those are eligible for the other person position. And I did verify with our legal team that there is no issue with you all recommending more than one person, even though there's only one vacant position. You can recommend more than one person for a vacant position for consideration if you so choose to do that. I would recommend voting for each of these if you choose to do that this evening individually, though, just to avoid any potential confusion about which positions are moving forward.
I'm sorry. Well, Jen, I was just going to ask a question for clarity for myself. So we have 5 applications, and how many vacancies do we have?
So if you will look, and give me just one second, I apologize.
Page
Page what?
2
2?
in the packet.
Oh, yes, on page 2, but I was thinking that we also included a summary page. Yes, what page is that? Page 20, 19 and 20. I guess it's actually just page 20. I tried to do, just because it is a number of positions, so we put together a little summary chart for you so that you can see. So for the, if you look down, going to number 7, for the dentist vacancy, there's 1 vacancy and we have 1 applicant for that. For the other person vacancy, there is 1 position that is vacant, and we have a total of 4 applicants, 1 of which you voted to move forward for the Board of County Commissioners to consider at your last meeting. And then if you go down to the registered nurse position, there's 1 vacant registered nurse position. There are 2 applicants for that position. Again, 1 of which you recommended we move forward at your last meeting. And for the social worker position, there is only 1 position, and you've already taken action on that at your last meeting. So no additional action is needed for the 3 individuals that you took action on at your March 11th meeting to move forward. There's just a request for your consideration and action on those 5 additional applicants. So for the registered nurse, that would be 2 applicants for that 1 position. For the dentist, it's 1 applicant for 1 position. And for the other person, 4 applicants.
So then we already approved for registered nurse last meeting, didn't we?
You did, yes, sir. Mrs. Heather Rand, but we have subsequently received another application from Mrs. Jill James.
So on something like that, we just had to, even though we had approved, we had to go back and reconsider the other.
No, sir.
Right.
I mean, I think you all could take action to reverse your decision, but you've already taken action to advance Heather Rand's application for consideration by the Board of County Commissioners. So at this meeting, you would not be voting to take action on those 3. Those are slated to go forward to the Board of County Commissioners. The question and the action being requested for you to consider to take at this meeting is on the additional 5 applicants, whether or not you want to advance them for consideration by the Board of County Commissioners. And then obviously the Board of County Commissioners would only be able to appoint 1 person to each of those vacancies if there's only 1 vacancy for a particular type of position.
The dentist, does he automatically go through because he's the only one, or do we?
No, you would still take action on that. So there's no automatic, whether for you all or for the Board of County Commissioners.
Okay. I have a question. I was looking through it to see if I could see it. Is the other because?
But is not presently receiving services. And so the general statutes are not clear as to what exactly that requirement is, whether it has to be present. It's written as if it is current consumer. So
Well, and my question on that would be 1959, like if that would be considered current for consumers if your child was receiving services under 1959 Medicaid waiver, because that would be a yes versus Medicaid. You know, you could still not have Medicaid and still be a consumer through 1959.
I think,
and that would be a changer.
I think in that instance that the answer to that would be yes then. So if you are aware of that information, you can share that with your fellow board members and with us, and then
Well, I'm just asking because it would open up, some.
It would, and then what we could do is we could, well, I guess in that instance, you would not need to vote again for Mrs. King because you've already voted to move that application forward for consideration. We could just allow it to be considered for both of those slots. So are you indicating that that is a fact, and we can follow up then on that with her to verify?
No, it would be for both. Like, yeah, so,
everyone technically is eligible for the other person category.
if we could go through the others, I can see if I would be saying that. I would like to ask her.
Okay, and we can follow up after this
Yeah,
also,
yeah,
so,
to make sure.
to make sure
I
on
mean,
that.
I don't wanna, you know.
Yeah, absolutely.
So how do you make a motion to like move forward with others too?
Well, I mean, there's so many here. I just, whatever we do, I just want to be consistent. How we do things from whenever there may be vacancies that come up, or when everything we do, I think we should be consistent. When I saw these minutes and I saw all these different applicants up there, I said, wow. You know, then I remembered, a meeting or two ago that there were some questions about a particular board member. And so I did want to find out what was the sense of this board as far as, do we just take what's on application and go from there? Or is it, if you want to have a committee, I was thinking about maybe a committee, but if you have a committee, then I understand, I asked Janet that just not too long ago, that also has to be open. So I wanted to get, before we even go further, I wanted to find out what is the sense of this board, not the sense, but how do you guys feel about, do you want to have a committee and discuss it openly more, or do you just want to go ahead and vote right now, based on what's written?
I have one question for Carla, maybe, before I would have an opinion on that. I think it was you who got to speak with them, was that correct? Like,
Speak with who?
you got to speak to any of the candidates, or no?
To some of them,
To
yeah.
some of them, okay. I guess my question is, when we talk about a quorum, you know, because that has come up before, the more people we have, the larger the quorum. You know, like, and so is that part of the discussion when you do talk with them about?
Yeah, let them know what I guess our requirements are, that they need to be present, and I go over how often we meet and what months we meet.
That's my biggest concern. I mean, I think it's great to filling all the positions is great, but that's the more people that we have to have present to have quorum.
Any other comments on that, or thoughts or feelings?
I think if we're getting more people interested in volunteering and serving their community, hey, like, let's fill it all if we can. At one time, you guys had more positions, right? I know there was more when I came on too.
Yes.
So anybody
It ebbs and
willing,
flows.
I mean, it's not every day we get volunteers for volunteer positions on anything in Union County, so I'm for more as well.
So is everybody for just moving forward and taking a vote on each individual as we go over?
It's a lot to evaluate in a short period of time.
Yes, I agree. That's why I made that. That's why I made my statement.
Mr. Chairman, can I throw something out there?
Sure.
Just from, I guess, from a historical perspective, you know, being on the interview process, and Randy, I know you went through it, because
Mhm.
I remember
Yeah,
you.
I did too.
Yep. And so, 3 of us at the time, me, Commissioner Helms, and Meg, were you the other one?
No,
Megan
what's the
Shaw.
girl?
Yeah,
Megan,
it was Megan Shaw.
So we were able to do that, and it gave a sense of having a conversation and clarifying that, because I remember making the comment, hey, you gotta leave your politics at the door, because when you're coming in here, you're doing this because you're wanting to serve the entire community, not one segment over the other, or viewpoint. So you may, just from a historical perspective, it may be better to back up, to go through an interview process and get to know these candidates better, and then have your subcommittee bring back recommendations to the board.
So with that in mind, would we need a fourth, like for a subcommittee? I think it would automatically default to us 3, and then we need one more, or that would be our
You
decision.
can, that is 100% your decision.
Yeah, I think
Yeah,
that's good.
I think that's good too.
So we got to volunteer for a subcommittee.
Just so you know, Mr. Ford, that automatically is you and I and Brandy, and then anybody else that wants to volunteer.
Any other volunteers?
I can volunteer.
Okay, Margaret says she'll volunteer, so we have our subcommittee. Now we just have to get some type of dates, I believe, when we could meet. So you guys had an interview panel in the past, but did the individuals did they come in?
They came
Yes.
here.
And they have to do that because anytime that a subcommittee of this group meets, it actually
be
technically
open.
is
public meeting.
Okay. Okay. Well, Carla, can you help us with that?
Sure.
Okay.
I'd love to do that.
Okay, maybe we can talk shortly after the meeting and for some times, dates and times. Okay, thank you. We don't have to have a motion on that now, do we?
I think you
We're
probably
Okay.
should do that, just so that you know, and then what we'll do is, if you all schedule time in between now and, this time frame is your time, sorry.
So I'll make a motion.
Yes.
Okay. A motion's made for our subcommittee to evaluate the applicants for the board. I second it. All in favor? Aye. Opposed? Okay, motion carries. All right.
So we'll work with you to then get those scheduled. And then when y'all are ready to bring those back to this group for consideration, just let us know and we'll put it back on the agenda.
Thank you.
Because I didn't know it automatically pops up.
Okay.
Page 5?
Page 5.
Yes, sir. 4, sorry.
Page 4 is just the Child Fatality Prevention Community Child Prevention Protection Team.
Yes, that, excuse me, yes, that is correct, and me and Ashley are going to tag team this. She's going to be my clicker to begin with. I got a few slides here I wanted to cover. First slide, and this is to give you a little bit of background on the North Carolina Child Fatality Prevention Team and Community Child Protection Team. These are the two initiatives that were established back in the 1990s by state statute to really look at ways in which the state could prevent and try to address in a proactive way child fatalities and reducing those. That was back during the time when there were a lot of SIDS deaths. There were a lot of also other challenges and structure where we combine both the Child Fatality Prevention Team and the Community Child Protection Team. Me and Ashley co-chair the local combined team. Next slide. One of the key things that's done in the work, we meet quarterly. We review medical examiner reports and death transcripts, police reports, and any other records that might be available by other agencies or organizations of the deceased county residents who are under the age of 18 and whose fatalities are not due to abuse or neglect. We meet, gather that information, and discuss the outcomes of those deaths, looking at the services that were provided, the circumstances surrounding the child's death, and look for opportunities where there could be recommendations that may prevent those kind of outcomes in the future. Again, this is to identify deficiencies in the delivery of services to children and families by public agencies, and also make those recommendations for ways that future deaths can be prevented. And it also helps us in promoting and understanding the cause of child deaths in each particular county, and to see if there are trends across the state that might be addressed at a broader statewide level. These findings are used to determine those trends, target prevention strategies, and support community agencies in their efforts to provide support to children and their families. The local team recommendations are forwarded to the state, and then the state then makes recommendations to the State Child Fatality Task Force. Some of the things that have occurred over the past, in terms of recommendations that has been statewide, there have been ATV laws that were updated. There have been seatbelt laws for teens. There have been car seat recommendations, and ultimately laws that were put into play because of trends that were seen by these local task forces that got recommended to the state, and then further recommendations were made to help prevent some of those fatalities. All right, the next slide is you.
So along those same lines with the child fatality prevention team, like Dennis said, we chose in Union County to put both of these teams together. So we also have the community child protection teams. This is a little bit different. So typically, I'm gonna let y'all read the slides, I'm just gonna talk about it. Typically what happens is we get child abuse or neglect cases from social workers here at DSS, especially those cases that are particularly difficult to figure out or nuanced when it comes to the different systems working on that case. And we bring those quarterly to Community Child Protection Team to review, because we have at that meeting a group of professionals who are all working in our community to keep kids safe. So it's a really good place for us to bring cases where we're stuck, cases where we're really not sure on if there's a different referral that we could make, and those folks are able to help us figure out potentially how we can move forward with the case. We can also review or bring fatalities when they have resulted because of abuse, neglect, or dependency. There's also, outside of these two groups, there's going to be a state investigation if that happens, but we can bring them to Community Child Protection Team to review. We do, at the end of the year, just like with our child fatality prevention team, we provide an end-of-year report, which Dennis and I are going to go over in just a little bit. Do you want me to talk about the membership? All right, just to give y'all an idea of how the two teams are set up, it is statutorily defined who has to be member, judge, medical examiner, child care facility, and a parent of a child who has died. And so we're able to get the perspective of everyone, from your medical examiner to a person who had to go through that in their life. And it's really, for one of my least looked forward to meetings of the quarter, it really does bring a wide array of perspectives to the meeting, so we're able to get really good feedback on the cases we review. Yes, sir?
Who's your DSS board member?
We're going to talk about that actually after you're jumping ahead. No, we're going to talk about that. It used to be Missy Baker, but Missy Baker rolled off the board, so I think it's on the agenda tonight to talk about who our next one will be. Oh, and we can have 5 additional members that are appointed to represent any discipline. A lot of those are human services staff, because it brings in some of the other knowledge from our other staff members, but we can have a maximum of 5 of those. And then I'm going to pass it back to Dennis to talk a little bit about some future changes to the child fatality prevention system. We just had some new laws that were passed, and he's going to talk a little bit about what we know so far.
Yeah, one thing I wanted to mention too is that when we review these deaths are a year old. So you'll see in the report that for the child fatality prevention team, we are reviewing 2002 deaths and we're reporting on it in 2023. And in some cases, if there was a particular circumstance and there may be still outstanding information that's not fully available for a child that may be deceased in 2022, for example, that information may not be released until later. So the data is a year old in terms of what we're reviewing. The future changes to the child fatality prevention system, we don't know a whole lot about it, but there was session law passed this past session that's going to establish a new child fatality prevention system. Essentially, they're going to go ahead and sort of do what we've already done, where you combine both the child fatality component along with the community child protection component. A lot of the future changes are still forthcoming. They're working out the logistics, and you see a whole list of things there. That some of the highlights, there's going to be a larger staff in Raleigh that'll be able to provide additional assistance and education to local teams in the counties. Again, I mentioned that they're going to combine it at the state level, and there's also going to be, in general, more support. They're also going to develop a mechanism where we can provide some reporting into a national system, data system, so that the data can be utilized in a much more robust way nationwide, not just locally. Right now, we don't really have a system. We give our report. There's not a lot of commonality necessarily across county lines as to what that report looks like. So I think that system could be very beneficial as it moves forward. The duties of both the DSS director and the local health director are going to pretty much remain the same as they are currently. As I shared, most of these changes are going to occur in 2025, probably in January of 2025. So we've got a little bit more time, and as we hear more about that, we'll let folks know. We're eager to know as well, and I'm sure there's going to be some additional training that's going to have to take place for us to see what adjustments we need to make. Next slide. All right. Everyone should have in your packet the 2 reports that we submit this year. Annually, we for causes. That's not typically unusual, given that many of them are maybe prematurity or birth defects or those types of conditions. In terms of the children, the number of deaths for children 1 to 17, we had 9 deaths that were reviewed. And in that age group, the causes of death were 5 accident, 3 were illness or other medical conditions, and 1 suicide. You see the breakdown as well by race and gender and ethnicity of those particular cases. And then one of the key things that we do is look at what system problems have we identified through some of the review of these particular deaths, and are there recommendations that we can make? And over the course of fiscal year 23, for looking at these deaths, 2 things came to light. One is the proper child restraint or booster seats was not used in all some of the vehicle accidents, and that was an ongoing concern. Another system problem was that children that are excelling academically and are entering college before the average age may not be getting the support or counseling needed. We had one case in particular that was very troubling, a very academically excelling child that had seemingly a lot of things working for them that unfortunately it raised questions as to whether or not there was actually some things that could have been done to support that may have been missed, either through other family or the school system, or not. When I say missed, not as in like overt kind of things missing, but the support sometimes is not necessarily there for children who sometimes feel like they have the resources and or everything going together, and that can oftentimes be overlooked. And so that was one of the areas that we saw as a system problem that could stand for some attention. And so the recommendations were to continue to educate the community on proper use of child restraints and booster seats, as well as educational settings to provide counseling services and screening processes to see how children are doing socially, emotionally, as well as their mental health. And this is just to get at that more thorough assessment and support around mental health concerns.
I have a question. I've never looked at the rate of death for 0 to 1 to know if this is within norm. Have looked at it for under 18 before, like for minors, and it does seem like a lot of medical, with the birth defects, probably being the changer here, or prematurity, the other. It seems outside of the normal statistics. Is it because of so many of the deaths that we experienced were infants?
Yes. Yeah.
And that skewed the...
And in many cases, and that's not unusual when you're reviewing. I mean, most counties, the number of deaths oftentimes is skewed toward the younger 0 to 1, because unfortunately, many conditions such as prematurity, birth defects, is going to have an impact in that 0 to 1. So it does tend to skew the overall numbers of the 0 to 17. So that part's not
I thought maybe that was it.
unusual.
What drew my eye and what made me notice that and ask that, though, is because the illness still came in number 2, and it's not ranked number 2.
Yeah.
And so is that an outlier or a common thread in those?
I know that in going back and thinking about the cases, there were nothing stood out. I don't believe that was areas where maybe substance use or other actions or things were in play. So I know I'm rambling here a little bit, but it was there was nothing that really stood out that would have caused or triggered a specific recommendation other than what we kind of coalesced at.
One last question. Were these 24 all people who had been consumers within 12 months, or was it the county as a whole?
County as a whole.
Good question, also, Dennis. I think it was last year you showed some similar reports, maybe you and Stephanie, maybe. But the question I want to ask, when it showed you had the demographics up there again last year, and I was just wondering, when it said, such a small population, or relatively speaking, of the African Americans are black, and there seemed like they have just about half. I was wondering, and I asked the question last year, was it because of education, or maybe some of the mothers, those, I'm assuming those 6 are those group from some of the infants are less than 18 months or whatever, on the top row there.
Are you referring?
I'm asking, is that across the state, those numbers, like I said, 6 males were black, 7 males were white, so it's almost 50-50 there as far as the correlation. So the question I'm asking, is there a high percentage across the state like that? Last time we were asking, was it because of lack of education, that many of those, maybe the mothers perhaps, I don't know. I was trying to get some type of understanding why such a high percentage.
Yeah, and I don't know specifically across the state, because we don't see each individual reports that each county provides. I do know that one of the things that when you look at there can be commonalities. I mean, education often does play some role in it. Socioeconomic elements, and of course substance use. Those are all key pieces that can predispose for poor outcomes. And in terms of you're looking at race or ethnicity, it doesn't necessarily have to be. I mean, there can be. I can't remember what the past trend has been over the past years, because we're looking at such small numbers. It's a little bit challenging, since we are looking at small numbers on a year-to-year basis, to draw any conclusions about trends when you've got, you know, really, really small numbers that are at that point.
Do you know how the 15 breakdown though, for the infant mortality? That would be more.
We can get that for you. We don't have it right here.
Yeah,
I can
that's
tell you there is an annual report that the state puts out as a whole, that we could share with the board. We recently got it for the last year. Will that work? Okay. Does anybody have any other questions about child fatality prevention before we move to community child protection team? Awesome. So this is an overview of the cases that we looked at, and this one is within the actual year because these are actual live cases that we're working in DSS. You will notice that we reviewed a total of 4 child welfare and 1 adult services case. And I know that this says that this is the Union County Community Child Protection Team, but that 1 adult services case was an adult who had recently turned an adult and functioned on the level of a child. So we included that in because that person was actually the sibling, and we reviewed that case as a sibling group. So that's why you'll see 1 adult services case. The cases that we reviewed, these aren't exclusive, so some of these overlap. But the cases involved abuse, neglect, or dependency, and of those 5, 3 of them were active cases entailing near fatality, meaning that it was that drastic, the information that we needed to review with the group. I'm just going to kind of quickly read through this next paragraph because it does a really good job of explaining the different cases. So cases 1 through 2, that was severe neglect, medical neglect, malnourishment, involved 2 siblings who had severe health issues without me having to read to you what the most common issues are. I mean, it's almost always going to be finding appropriate placement and treatment for foster children. It's very difficult. It's easy to find it's easier to find foster families for younger kids that don't really have a lot of behavioral health or mental health needs. It is a lot more difficult to find placement that also includes treatment for these children. So it's something that we continue to work on daily. It's also, though, another thing that we noticed was we do have a need for more mental health providers, but we also have a need for more services for low-income parents who don't have insurance. So we can wrap services around the children. The children typically are going to have Medicaid. Before Medicaid expansion, which is was half of this because we didn't get Medicaid expansion until December, there was really nothing we could do when we had a parent that we were involved in their child welfare case and we knew they needed some form of mental health treatment. But finding a sliding scale fee even for that is very difficult. We do have Daymark here in Union County where we'll refer folks there, but it's really hard to find individualized treatment. They offer a lot of group therapy. It's really difficult to find that on an individual level. We don't send recommendations to the state for community child protection team. This team really exists to help DSS social workers with those really tough cases and figuring it out. So the other perspectives from the team members actually helped on all of these cases. We were able to come up with some out-of-the-box ideas on things that we could work on, and then, I mean, there's not much that we can do about finding placements and treatment. We can't invent placements or treatment options, but we can, on other state committees, between all of the different professionals in our groups, encourage the state to continue working on that as a resource. So, does anybody have any questions about community child protection team?
I just have one.
Sure.
Of these instances where you have low-income parents who don't have insurance, between Obamacare and Medicaid, what do you see, what do you find is the reason that these low-income parents might not have the insurance?
So pre-Medicaid expansion with the Affordable Care Act, it is not mandated. They tried to have it mandated, but it didn't really work with the tax, not incentives, if you didn't have insurance, you would get hit with this with your taxes. I don't think it really impacted people that much, so it was still a cost to them many times, especially for a working poor. With Medicaid expansion, a lot of those same people now could qualify for Medicaid, but that just started December 1st, and not all of them know that it's even available. think the state is trying to do their best to get the word out. We've done some informational things here with Human Services, trying to get it out through social media. And on the screens just here in the building, when people come in for something else, we'll have information up. But I think it's just a lack of knowing that they have that as an option. We do, though, with these cases, because they interact with our child welfare team, our social workers know about Medicaid expansion, of course. So they're able to now refer them to apply. Any other questions? Thank you.
Good evening, everyone. My name is Emily Colson, and I am a program manager here. I manage the WIC and senior nutrition programs. But today I'm going to focus on the senior nutrition program. So I appreciate y'all taking the time to learn about our program. Just a broad overview of our program. Our goal is to provide nutrition services which enable seniors to maintain or improve their health, and ultimately to be in their own homes as long as they possibly can, just to age in place. So to do that, we offer nutritionally balanced meals in two different ways. We do congregate dining, and we also do home-delivered meals. So to be eligible for dining at our congregate sites, they just have to be a Union County citizen who is 60 years or older, and their spouse can also attend with them, regardless. At least 700 calories in them, and they provide 1/3 of the RDAs for other vitamins and minerals. And at the sites, each day there's some sort of activity. So we'll have sometimes outside groups come in and do different educational opportunities. Like you can see in the top picture, we had Debbie Dillon, who's a Union County Master Gardener. She came in and did a planting activity with the seniors. On the bottom, they made placemats, so they're just always engaging and doing a different activity there each day, and that's a huge benefit. I'll talk about later, a lot of these seniors live alone, so this is sometimes the only interaction that they get. And those sites are staffed by part-time site managers and assisted by volunteers. And here's just some of our numbers over the last couple of years. This current year so far, we've served 99 seniors at our congregate sites. 90% of those live at or below the poverty level, and 75% of them live alone. And we've kind of run the gamut of numbers over the last couple of years. We shut down during COVID. A couple of years after that, people were still kind of nervous to come back into the sites. So our numbers were still pretty lower than they were during COVID. And then this year, we're actually starting to tick back up a little bit. But a lot of that has to do also with, we moved our Monroe site. It used to be at a housing authority building. And now we moved it to the newly renovated Bazemore Active Adult Center. So now we're housed in the Active Adult Center, which serves 55 and over. They serve a little broader than we do, but so yeah, we're where the people are, and so we've seen a significant increase, especially at our Monroe site this year after that move. And our home-delivered meal program, similar, it's open to any Union County citizen who's 60 years or older and their spouse, regardless of their age. The biggest difference is that these seniors have to be determined to be homebound. So we have staff who go out and do a home visit, and they do an assessment and determine whether or not the senior is homebound. They have to be physically or mentally unable to obtain food or prepare meals and have nobody who's willing to do that for them. And they have to be unable to leave home at will, meaning they're not able to just go to one of our meal sites. And so if we determine that somebody is eligible and we have a spot for them, we have two ways that we deliver meals. So the first one is warm meals. And those are delivered daily, Monday through Friday, lunchtime meal. Same as the other meals, 700 calories and 1/3 of the RDAs. And the meals provide regular interaction with volunteers. Again, a lot of these seniors live by themselves and they're isolated at home. So they very rarely may interact with another human being. And those warm meals are packed at the congregate sites by the site managers. And then the warm meals, we have 29 meal routes that go out each day, and those are all delivered by volunteers. So we depend on 145 volunteers each week to deliver those meals. Let's get back to that. And then the other way that we do our home delivered meals is through frozen meals. So we're kind of limited with the hot meals. They have to be delivered within an hour of leaving the meal site, just so we can make sure that they stay a safe temperature. So we can't really reach the rural parts of our county with those because they come out of our congregate sites, and we've got 4 of them, but we can't reach the corners of the county. So we were able to open up a frozen meal program or expand our frozen meal program, and that way we can kind of reach the corners of the county. And so those are delivered a little bit less frequently. We have some going out weekly and some going out every other week. They meet the same guidelines. And again, it's a little less frequent, but it is still regular interaction with the person. And then those meals are prepared in Mississippi, and then they come to us out of Charlotte. So we serve right now about 140 people in our frozen program. So here's the numbers for that. You'll notice starting in 22, and we went down in 23 and again down in 24. And that was sort of by design. Those are at or below the poverty level, and about half live alone. And again, it's lower compared to last year. At this point in the year, we had served about 450 unique seniors. So we pulled back pretty significantly. And then, yeah, so we're expecting about a 16% decrease this year from last year. And our wait list. So I mentioned our congregate sites don't have wait lists, but the same is not true for our home delivered program. So this is a map that was current in March. We had 534 waiting. This evening I pulled it again. We have 555. So it is going up fast. And you'll notice in FY21, that's when we had all that extra COVID funding. We were able to pull everybody off the wait list. Then we saw that funding was going away, so we restarted the wait list in February of 2022, and then it's just grown crazy since then.
Emily,
Yeah.
pre-COVID, what was the wait?
Pre-COVID, the highest I ever saw in my 2 years before COVID was
about
200-ish, yeah.
For reference, I
Yeah.
think that's
It was
an
like
important number.
It was about 230 when I started.
Yeah, so this is a lot, and a lot of things play into that. Food is really it's just expensive to be alive now, so, and that hits seniors especially hard, because a lot of them are on fixed incomes, and just, they're making hard choices, and so a lot more people are reaching out for food assistance than they did before.
What would be the average food maker? We say it was frozen meals, and I see you have such a wait list. What would be the average makeup or consistency of that frozen meal?
So if you imagine like a TV dinner, it's really similar to that. They just have to be a little more nutritiously balanced than what you would think of in a typical TV dinner. But I mean, they try to cater to the southern. There's a lot of sweet potatoes and pork chops, and they try to make them as
pretty
good as they
tasty.
can. Yeah.
And there's still 700 calories
Yeah.
and 1/3 RDA.
Yeah, meet all the same guidelines, which is frozen. All right, so here's the big picture of what we're looking at for especially the upcoming year. Food especially is our hot meal costs for next year. Our previous contract expired, so we had to go through the new contract process, and our meal price for next year is going to go up about 35%. So that's significant, and so really just to maintain the current level of service that we have now. This is not to take anybody off the wait list. This is literally just to keep serving the people that we are currently serving. Is gonna cost us about an extra $170,000 next year.
Which we don't have.
Which we don't have. That's important.
And you're already had to cut back 16%,
Yes.
and that's mainly in keeping people on wait lists.
And that was just, yeah, this past year we cut 16%. The previous year, I want to say was about another 20% cut that we did.
So as people moved, passed away, we just didn't replace folks, especially with the frozen meals. I think we're down to about 70 people we're delivering to.
Yeah.
Average, whereas when at the height of COVID, we were at what?
220.
220. So again, we've just consciously decreased or just not replaced people as they've gone off. And when we've lost more meal people, we try to shift those that we potentially can off the frozen meals because they're so much more expensive. So move them over. So trying to economically do what we can. But the price of food is just, it just
Hospital or having to go into a nursing home. So it's an incredibly cost-effective intervention.
So who does have the funding? Because ultimately, it's not saving money.
if you could figure that out, you could let us know. Seriously, we've asked the county for an expansion, or just to fund that, because we've, anytime we can apply for a grant, we do, but there's just not a lot of grants out there. And Meals on Wheels sometimes has them, and we certainly will apply, but there's just a lack of funding. Unfortunately, HCCBG is the funding stream we use for the meals. That has not gone up. It's really remained pretty flat over the last, I don't even know how many years, probably 20 years. It increases just very.
It's gone up some.
It's gone up some. So say it goes up 3%, but your meal cost goes up, 35%, or even if it goes up 10%, it just, you can kind of see on here just over the last 3 years the difference in funding.
So I have a question.
Do Atrium and Novant try? Go ahead, Nick, sorry.
The county funding went down from 500,000 to, I don't remember what it was on that slide, but from almost 600,000 down to 30,000?
No.
No, that's the difference between it, so it's actually projected to go up by 30,000. That last column is the difference between 24 and 25.
And that'll cover staffing costs pretty much. That's what we're projecting, some of the staffing costs and other operational costs to go up. That's just a projection. We don't know. So the bottom line, the first three are just how much county funds we've received.
Do the local hospitals donate, or can? I guess it's two questions. Can they, and if so, do they?
I don't know the answer to the first question.
Okay.
But the second question is no.
No. Okay.
And do the local hospitals track how many people come in?
Yes, we get lots of
in a
referrals from
state
that.
of
We do get a lot of
malnourishment.
referrals from,
Or for a
Yes.
warm meal?
yeah.
To the ED.
Since you wrote here, or you had in your slide that 90% of the seniors are below poverty level, do they also get food stamps, or is it just these meals?
Yes, and so one of the things that we do is we'll have different assistance programs come into the sites and sign them up right when they're there. So we definitely make that available to them, and we try to make sure if they're not, because that's one of the questions too that we ask during the intake screening process, is related to SNAP benefits. And
So even if they're not getting frozen meals or home delivered meals, they'll still end up getting food stamps?
yes, so that's.
We don't have anybody starving, like.
Well, I mean, it's not a ton of money that they get, and also that might be really beneficial for somebody who can get around, but for somebody who can't really get to the grocery store, they can't get out of their house, which is our home delivered wait list. Even if they have access to those benefits, they don't really have access to use those benefits. So
Is there a collaborative relationship with someone like Loaves and Fishes for the people who fall in between, or the people who are waitlisted, where they can get a food box?
We refer, so as soon as we put somebody on the wait list, we have a list of different food resources that we'll send out, especially for the home delivered ones. We have, there's a couple that deliver. Well,
Common Heart.
Common Heart does like monthly grocery deliveries.
1 month.
Yeah,
Just
so
once.
we try to send out the resources that we know of, just to kind of help bridge that, but, yeah, it's definitely a challenge, especially for the homebound seniors. We kind of talked about this a little bit, but notably on the 25, we're expecting that green slice makes an appearance. We're expecting about a 16% deficit. So the challenge is the population is aging. You can see on the picture on the right-hand side is Union County specifically. We're expecting to see our 60 and over population more than double in the upcoming years. And funding is just not keeping pace, and especially when inflation has been so significant.
And maybe some others in the room, but it's really rewarding to go out there, and they're always so happy to see you, and you develop a relationship with the seniors. So it's really a great thing to do. But we know that people aren't always available during that time of the day. So usually it's between like 9:30 and 11.
Usually between 9:30 and 10:30 is pickup time for meals. So
Is there a criteria, like people, college students, do they need to obviously have a driver's license, Union County resident?
there's
Do background.
yeah,
We
the
do
only
a
thing would be a
background check.
background check. But yeah, we do typically ask that they drive or have somebody who's willing to drive them. We have some who deliver with their like minor children or grandchildren. But yeah, as long as they can drive and have a clean background check, then we're open to anybody.
And that can be 1 day a year,
Yeah.
1 day a month, 1 day a week, 5 days a week, whatever someone's schedule might allow, if you just want to be a fill-in. And just want to be on a distribution list that, so when there are cancellations, and the number, in case you aren't going to give it out, and in case anybody happens to be listening, the number to volunteer is 704-792-2567. There's also a link on the county's website to the senior nutrition program. They can give a little more information, as well as a referral form, which obviously, as has been mentioned, we have a waiting list, but you can't get on the waiting list unless there's a referral made. So all of that information is available there.
Has there ever been any kind of like attempt at outreach, like to hit the local colleges, the kids looking for community service worker?
Yeah, so we've recently met with SPCC, and Wingate, and, so we're kind of exploring different paths.
And I was going to say, during COVID, when the kids were remote on Fridays, we did get some kids who were able to, seniors in some of the high schools who were able to deliver. So that's the biggest issue, is having, it usually is like a first, second block kind of time period. So it's finding them having enough time to actually go out and do that work.
And one other question, is this like the congregate meals, can they come for breakfast, lunch, and dinner, or it's just?
It's only a lunch meal, yeah.
But you do the food box, and we do some food boxes during holiday
Yeah,
long weekends.
Well, we partner with a Second Harvest Food Bank, so our congregate clients who qualify, which is at or below the poverty level, so 90% of them qualify, they get to take home a commodity supplemental food box each month, and they're substantial. They're like 50 to 60 pounds usually each month, filled with just commodities, so we're able to provide those. And then like Stephanie mentioned, if we have, especially like Thanksgiving weekend, or when we have long stretches that we know we're not going to be able to serve meals, the day before we'll send out out a shelf-stable meal box with a couple meals in it. So we try to plan ahead for those types of things, just to make sure.
Do you have a spot on your website too, like if I wanted to share a donation, like with people that, can they?
Doesn't have like a mechanism
Post
like
on
that
social
set up,
media.
but we do.
We need to.
Yeah. Yeah. But we can take, checks in cash mailed here. So.
That is
it
good to
an
have
option.
something like that. People, you know, it'll be their birthday, you post on social media for my birthday,
It's a quick
donate
link.
to this.
I love it.
Yeah,
People,
that's
you know,
right.
like,
That's a good
I
idea.
mean,
Like easy and
people
fast.
give.
Yeah.
And something we haven't done, but something we are contemplating and asking are the municipalities to help out. We haven't gotten there yet, but, I think there might be some
what way?
interest in doing that, some of the municipalities.
Like in what way?
They have tax. To,
Financial
donate.
donation.
Money, yeah.
Or volunteer.
Or volunteer,
Cool.
yeah. We'll work on a donation page.
Yeah, I think that's a good idea.
Awesome. Any other questions? Thank you all for your time. I appreciate it.
Thank you.
Appointed from this board.
Is it quarterly or monthly?
Meet quarterly.
At lunch.
Do we nominate someone or?
It's how the chair would like to,
And it can be done at this
receive.
meeting or
Yeah.
a future meeting. We just wanted to make sure that we bring it up to you because that slot is vacant now with Missy's departure.
So just full disclosure, I discussed this with Dennis at the end. Dennis and I have worked on past things together. Obviously, I have a very similar background to Missy. I discussed and shared some of my extensive background that deals hand in hand with some of this stuff, and I am interested.
So you volunteer?
Yeah.
Okay, well then I would,
Make a motion.
okay. Mark makes a motion for Brandy to serve on that particular group. I second it. All in favor?
Aye.
Aye. Opposed?
Thank you.
thank you. The last item is the Consolidated Human Services Board Handbook. You have a copy of this. I want to point out too that we are in the process now of our accreditation for this year. In fact, May, the end of May is when all of our evidence needs to go in. And one key element of the accreditation is governance and the work of the board. And so we need to make sure that y'all have various pieces of information that can help support us in the accreditation process. And so this particular handbook that Carla has put together gives you a lot of different pieces of information, rules and procedures, certain board policies that
That's what they wanted 2 months ago.
have gone over a few months ago. So all this is here in the particular manual. So I don't know if there's any action. It's just acknowledging that we have provided that for you, and appreciate you looking through it.
It also includes the orientation materials near the back, or at least the majority of them, some of them that you all would have received during your orientation, a little bit more updated now, just because we looked at them recently. So any of the new members that are appointed as they go through orientation will receive this and have this information.
I haven't had a chance. It looks good to cover, it looks good. Have a chance to digest this, I guess, later. It looks nice. So is there any other business do we have?
Want to do updates? Jackie, you have anything? Dennis, anything else?
I don't really have anything. I did want to welcome our new epidemic epidemiologist started last week before last, Ana Diaz, so we'll have her here for a meeting in the future. It's a key piece of our puzzle in having epidemiology support, something we learned very quickly during COVID, so it's nice to have her on board.
On behalf of Teresa Torres, Transportation Director, she is actually at the North Carolina Public Transportation Association conference right now, and is working hard, and didn't really want me to provide any updates, but I want to give her a shout out. Whether she's thrilled about it or not, I think she probably is, but she is going to actually be chairing that conference. She's on that board, and so she's going to be chairing that conference actually for the next 2 years, so that will be a great opportunity for Union County and for her, and it's a very good statewide organization. And also, Michelle Marcano was unable to come to this meeting, but will be at next month's meeting, and wanted me to let you guys know that we have a vacancy for her administrative position, but she has been blessed to receive 12 applications. So that's a good thing. It's within Union County, and Michelle Marcano and that veterans team does a lot to support them. And so we're proud to be working with the City of Monroe, and we plan to be, again, sharing a screening of that film on the evening of Thursday, May the 2nd at the Dowd Theater. And so when we solidify all of the logistics for that, I think it's probably going to be at 6 p.m., but it may be at 7 p.m. So when that gets nailed down, we will share that with you all, and obviously via social media, so that you can share with those who might be interested in attending. And then I want to take the liberty also to just give a quick shout out to a couple of team members and teams. So Union County does a pretty awesome job of celebrating employees in a lot of different ways. And if you guys probably have never been, but once a quarter we do a recognition of all employees who have 5 years, 10 years, 15 years, 20 years, 25 years of service, etc. And that is one of the coolest events that really, honestly, you could go to, because the supervisor or someone who works with that individual recognizes them and tells just a little bit about what they do, and that's just a really special way of recognizing employees in an ongoing manner. But once a year, we have a couple of really special things happen, and we've just had those happen this last month. And so I just want to recognize that we have quarterly awards that are for nominations by a coworker in recognition of efforts for their peers going above and beyond expected roles in their job description. And I'll do a better job of bringing these to your attention going forward. But at the end of that, we do a team award and we do individual awards, so each quarter. And at the end of each year, the management team votes on the winners of that for the annual Call in the Act Award. And I'm thrilled to say that this year we have one of our team members, Jamal Gardner, who is a school social worker with the DSS Behavioral Health Collaborative and serves in the Union County Public Schools. He was the Call in the Act Employee of the Year Award winner for 2023, which is really cool. So he was recognized for preventing a potential crisis involving a student in the school system. And as we all know, mental health is very complicated, and the resources available are not always sufficient, but Union County has really gone above and beyond, and our board has gone above and beyond in establishing that team. I'm just really proud of the team and the collaborative team and Jamal. And then we have 5 groups of Union County employees that actually earned the team award. The management team decided that they were all really awesome, and so wanted to recognize all of them. And 2 of those 5 are actually from Human Services, which rocks. One of them is a business operations team, Jackie's business operations team, Amanda Autry and Gabriela Ramos Dominguez and Michelle Horkin. And the other is within social services and the sheriff's office. And that is Minnie Hewlett, Chandra Page, and Laura Reinhardt, along with our sheriff's deputy who is assigned here, Deputy Willie Blackwell. And so really proud of those. And then the last thing is a really cool award that began 3 years ago in honor of a fella named Bobby Cobb, who some of you may have known. He worked with Union County for several years as the interim public health director, and then served as really just a guidepost for staff as we were navigating the work from home situation, all the other things that there really wasn't any resource to help us figure out from the COVID perspective and how to navigate that. And so Bobby passed away a couple of years ago, and the county created an award in his honor, and it is to recognize employees who go above and beyond to provide invaluable services and exceed expectations, specifically for efforts that involve collaboration and coordination across multiple county departments. And so this year there were 5 recipients, all of whom we are.
Thank you, Janet. Before I begin my updates, I would like to encourage everyone to join me in a round of happy birthday for our very own board chair, Earl Ford. Used to work with me at DSS, so his birthday will forever be in my Outlook calendar, and it popped up a reminder today that his birthday will be tomorrow. So whether or not you can sing, join in. I'm turning off this mic because I'm going to sing.
We have some other important business before that.
We'll get to that in a little bit. Happy birthday to you. Happy birthday to you. Happy birthday, dear Earl, Mr. Ford. Happy birthday to you. And many more. All right, the DSS updates are, can I have a drum roll? Thank you for obliging. We are 97% staffed in DSS. I know that will be different probably tomorrow or a couple of days from now, but right now I'm very excited to report that out to you all. Also wanted to share with you all, if you don't know, April is Child Abuse Prevention Month. And if you came in our front entrance, you may have noticed the little blue pinwheels that we planted amongst the flowers out front. The pinwheel represents Child Abuse Prevention Month. So we had fun, all the social workers. We all went out there and put those out. Coming up at the end of this month, I'll be attending the first annual Carolina Seaside Symposium on Child Abuse and Neglect. Looking very much forward to that, taking several social workers along with me. I think it's going to be an absolutely fantastic training for us. It wasn't mentioned, but this is a group effort. We have a FEMA nuclear graded exercise coming up on April 16th, and so we have volunteers from throughout Human Services and actually other county departments who come together to put on a shelter event for if there was some issue with York County's nuclear plant. Then people would leave there and come to Marvin Ridge, and we have to set it up and reenact as if we were going to handle all of that. And so FEMA's coming down to grade us on that on April 16th. And I think that is pretty much it.
I just have a few quick items. So first of all, I do want to shout out to my team. I think almost every one of my departments or areas was audited in the last couple of months. Emily's, both her programs were audited within a week of each other. The WIC audit is pretty intense. It happens every other year in person, and on the off years, they do a self-audit, and they did phenomenal on that. And then she also had a senior nutrition audit, and it was the first time they did that in person, because it's been remote, and we've kind of self-audited. It was the first time in like 3 or 4 years, since she's been here. Emily, I came on board 5 years ago and then hired her a couple months later, so she's hitting her 5 years. So it's been a little crazy, but also
all done a great job and have had, you know, minor corrections, but we always expect that to help improve. And then one of the other things that's happening with the community health assessment, which as we've talked about in here happens every 3 years, is we're working with surrounding counties in our region. So Dennis, you may have to correct me if I'm wrong, but there's how many, 9 or 10 counties in our region? 9. And also one of the regions next to us, to Region 3. So we're working collaboratively to really come up with, you know, just, and working with Atrium and Nova and getting on the same cycle together, working on resources together. We still all have to do our individualized health assessments, but really looking at how we could streamline everything from surveys to focus groups to just whatever the case may be. So we're working on that effort, and I think it's really, really exciting to be doing that. And that's about it.
We have to have our esteemed commissioner representative.
We're going to do that job, and I just wanted to let you all know that the board of directors and specifically the executive committee is now tasked with interviewing candidates, and Rhett has announced his retirement as of June 30th. So we're getting busy with interviewing candidates and finding somebody worthy for that role. So if any of y'all have any questions or have some suggestions for this process, certainly don't be shy about letting me know. In my opinion, Rhett's done a fantastic job. I think the LME MCOs and specifically partners have occupied a pretty special place in this landscape. I mean, they're, as you know, kind of a special entity, a creature of statute, a not-for-profit that I think borrows some of the best from the private entity world, but also kind of has a public character. And in my opinion, Partners discharges that role pretty admirably. And Rhett, at the top of the organization, I think has done a really good job of managing it and leading it in an environment where sometimes the landscape is one of regulatory chaos, depending on what's happening on Jones Street in Raleigh and with changing regulations elsewhere. So not to get into that or belabor that point, but I just want to let you know about that news that the Partners Board is getting busy with interviewing candidates, and you know, we hopefully will make some pretty good progress in that area sooner rather than later, and well before Rhett steps down in at the end of June, have a worthy replacement. So that's the big news there.
Is there anything coming before the county commissioners related to health and human services?
Well, I mean, we have the upcoming fiscal year that obviously we're going to have to tackle and pass a budget for, and the needs we talk about in this room pretty much every meeting are needs that we wrestle with in terms of how we fund. You know, just to be very blunt with you, the current environment, fiscal environment, is challenging. You know, inflation has hit every area of the economy, and in past years, the county has been fortunate to exceed its revenue estimates, and especially revenue estimates on sales tax. And the projection for this upcoming fiscal year is that you know, sales tax revenues are going to drop off. That the consumer has hit a wall, you know, straight up. So in past years where we've had, you know, 18, 19, nearly 20 million in extra revenues to play with, we've got less than $1 million this year in unallocated fund balance. You know, that's that's extra to play with. And we've got, needs in human services, but we've also got needs just across the spectrum. So we're going to have to make some hard decisions, and I'm prepared to make those hard decisions. I'm one of 5, and should be interesting. So.
Commissioner Reeves, I was going to ask a question. How do we look, as I drive around the county, I see so many housing starts up. How does that look as far as for revenue there, as far as going into the general fund, when you see all these housing subdivisions popping up?
You mean in terms of like residential building?
Yes.
Okay. Well, I don't want to get in trouble here, but there's some let me just say this. There is some building that is within the control and influence of county leaders and municipal leaders, but there's a whole lot of building that happens that's entirely, the owner is entirely empowered to develop that lot as they see fit. And then there's the activity in the municipalities. So it's important, I think, to kind of set the stage there, because there's not a whole lot that we can control or even influence. But speaking to your specific question about the financial consequences or fiscal consequences of building, I think it depends on what kind of building. If you're talking about residential building, in this commissioner's opinion, and I think good people can differ, but in this commissioner's opinion, new residential developments don't tend to pay for themselves. What does that mean? Well, it means that the costs, both direct and kind of indirect, of residential building are higher than the benefits. And certainly in a direct benefit of residential building is ad valorem taxes that go to the county or municipal governments. But you've got, costs in terms of educating children. You've got, just the whole spectrum of services, of law enforcement and fire and, and then all the other services that we as a county and municipal governments provide to our citizens. And when you look at all that, you find, I think, that new residential development doesn't tend to pay for itself. And then you've got costs that perhaps are more difficult to financialize, to put into dollars and cents, but that we can all appreciate, like our major thoroughfares and arteries and roads getting more and more congested. That's not a cost per se, but in terms of dollars and cents, although I think one could probably extend it into that. So residential development isn't really a plus in terms of revenues. Now, you've got other kinds of development, like commercial development, which does pay for itself. One of the things that was made clear to me early on in my term was just how much it does. It's really remarkable. And so I hope that kind of answers the question there. There are other kinds, in terms of commercial, let me just kind of give a shout out to Monroe. I think Monroe is doing some phenomenal things, not just for the city proper, but entirely for the entire county. The way that it's developing the airport, our executive airport. I think there are going to be some real opportunities there for commercial development, for jobs, for increases in business personal property taxes that are a great benefit to Monroe and to the county. But the short answer to your question is residential development. We've all got to have a place to live, But in terms of financial benefit, in my opinion, not much. There's not much there. And it's one of the reasons, why, I mean, I've never voted for a high-density residential rezoning. Not that I would never do that, but I've never done that. Yet I'm also a commissioner that thinks it's responsible to make sure we have some capacity for water and sewer. And some might think that's, that's an oxymoron, but I don't think it is. I think to the extent we can control and influence positive patterns of development, we should, while maintaining some sewer capacity. Anyway, I tend to.
Yes. As long as y'all would like for that to occur. So I think maybe if y'all could direct us to make that happen, that would probably make sense, if that's what you'd like to do. If there are any additional applications that came in, say, today or tomorrow, and we receive them before you all have your meeting, if you could go ahead and vet all of them. Which I think that makes sense, because you're not taking any action, you'll bring that back to this group, so. And in terms of scheduling, absolutely, if you have a minute,
few
why
minutes,
don't we hang
sure.
out and look and see if there's some dates that we could figure out that might work.
And you also have to get with the applicants too, so I'm not sure, that's why I mentioned, do you want to reach out to them first, or
I think we
just?
should connect with you guys first and
Okay,
then tell them.
any,
what
to the
your
dates that we have
timeframe is.
available?
Yes.
Okay, sounds good. Okay. With that said, if there,
And a motion to adjourn?
yes, a motion to adjourn? Margaret has a motion to adjourn. Second, all in favor, say aye.
Aye.
Aye.